I want to give you a brief update, this time in video summary of a recent conference that I attended, the Beljanski Integrative Cancer Conference. I attended this in Austin, Texas just last week, and I feel like partially it is my responsibility to take in this information, to bring the education to you, and to share the highlights that I took away from this conference. We're all such busy healthcare professionals, it is hard to get to them all. So I think it is part of my due diligence to share with you. And I'm excited to share some takeaways that I had from the Beljanski Integrative Cancer Conference. So, of course, that's bringing and blending the most prominent modern medicine tools that we have, blending that with functional medicine and creating this integrative approach for cancer patients. Now, one of the things I was most excited about for this conference was also focusing on prevention, because as a pharmacist, just like you're seeing in your practice, we have a lot of patients that have cancer that are coming into our pharmacy. We really want to help them understand, be connected, have the tools, the resources, and the education to be able to fight for themselves, to fend for themselves, and to approach their life in a preventive manner. Now, I'm going to be sharing some information that is quoted by speakers from the Beljanski conference, and then I will round out with some information about compounded medications. A lot of this is going to include some lifestyle and dietary recommendations, but that's obviously an important part. So I want to share that with you. But again, I'll round out with my own personal information as far as the pharmacy goes, but I will be quoting out some of the lectures throughout this conference. So with roughly 1,700 people dying per day from cancer, I think this is some really important information that we have to pay attention to. There were clinic leaders from Mexico and from France, and of course across America. Dr. Jimenez from Hope for Cancer, Dr. Lear and Keneally from California, and some of our top prescribers, which was really great to be able to connect with them in person again. So something that Dr. Jimenez said, which is with Hope for Cancer, is that a negative thought can kill you worse than a bad germ. And I think that we know this every day. And even as healthcare professionals, we have to be very intentional to give our patients consistent hope and positivity and not discount the role that that plays in their healing journey. And it is amazing how many times that I have the opportunity to act like a cheerleader for a patient, and for them, that makes all the world of difference. And I know that you play the same role too. So it's very important to bring positivity and hope to these individuals. Dr. Lear and Keneally did touch on the fact that it can take roughly 8 to 10 years for cancers to develop. So there were a lot of questions around screening and what types of screening to do and when to do the screening. We know that we can get ourselves into a situation of screening in ways that can increase metastasis, and we do not want to do that. So we want to be very intentional about the way that we test, which tests we use to test, but also how often do we test. Sometimes breeding too much anxiety or thought around the development of cancer can do more harm than good. So as long as we can have confidence in our preventative approach, we will be best off there. Of course, we talked a lot about mitochondrial function. We know at this point that mitochondria is largely a metabolic disease. And so with that, what do? We know we have a lot of compounded prescriptions available at our fingertips that can energetically change the function and the preferences of the cell. And a lot of that happens at a mitochondrial level. But additionally, we know that nutrition impacts that, of course. And so we want to be very diligent about what we feed, and also the vitamins and minerals that we take in to support mitochondrial function, or which may be doing mitochondrial damage. Also, vitamin D is something that I focus on regularly. When I see patients and I'm looking at their labs, it's not uncommon I literally will venture to say that 100% of people that come to me that have been diagnosed with cancer are severely deficient in vitamin D. And just like we saw with COVID, or we see with diabetes or some of these other conditions, although being deficient in vitamin D, and when I say deficient, it can still be in the quote unquote normal range. When they're vitamin D deficient, that may not cause the autoimmune condition or the metabolic condition or cancer or whatever this diagnosis is. However, it's certainly correlative. So I really like for my patients to shoot for a vitamin D level above 100. And I believe that that's where we really start to get a lot of the anti-cancer benefits. It's hard for some people to get there. Not everybody gets there with the use of over-the-counter vitamin D. And so sometimes transitioning over, like someone like myself has had to do, to the prescription vitamin D, which is a 50,000 unit capsule, taking that maybe once every 10 days, once every 7 days, or even once every 5 days, depending on the individual, can really help them reach that threshold. But one thing that is important about vitamin D, other than it being an anti-inflammatory, we know it has anti-cancer properties, is that it regulates genetic function. And so, although cancer is not a genetic disease, epigenetic changes can really impact the functionality and the development of cancer. Dr. Joel Furman discussed the nutritarian diet, which was a new term to me. And I really enjoyed this because here, again, we were talking about cancer prevention. So for the past week or so, I've been eating as he recommended G-BOMBs. G-BOMBs is an acronym. So this one stands for greens. So that's lettuce and cruciferous vegetables. B is for berries. O is for onions. M is for mushrooms. B is for beans. And then S is for seeds. And you can also lump nuts into there. So greens, berries, onions, mushrooms, beans, and seeds and nuts. So something I found very interesting about this lecture were some of the decreased incidences of cancer as they relate to certain foods. For example, he says that eating beans, just 2 servings per week, can decrease the incidence of cancer by 20%. Also, he discussed isothiocyanates, a new concept to me as well, which provides the benefit of being an anti-inflammatory and serves as an anti-cancer benefit. But just like other things in the body that we think of, like DIM, for example, that can be used to regulate estrogen metabolism, this is formed through the digestive process. Isothiocyanates, or ITCs for short, are formed during the mastication process, so chewing and digesting. So they're not present in the vegetable themselves, okay? So you create ITCs with good mastication. This is partially where the oral cavity, so the functionality and the structure of the oral cavity starts becoming very important in this conversation. And those ITCs have the highest benefit when they're mixed with your saliva. So slow down when you're eating. Encourage your patients to slow down when they're eating and liquefy the food in their mouth. Also, keep these foods raw. So to make ITCs, if the patient cannot masticate appropriately, then next best option would be to blend or juice raw cabbage, Brussels sprouts, bok choy, watercress, collard greens, kale, these types of vegetables raw. So blend them raw or juice them raw, of course, and then pour them into a soup. So for cancer patients who have trouble swallowing, a soup can be a nicer option. Also, what about ketogenic diets? So when cancer has the tendency to metastasize, we learned that it is not optimal to be putting them on a ketogenic diet. So although it may initially cause some shrinkage of the primary tumor, the tumor can then metastasize. I think a lot of this is also that the body is smart. It begins to catch on what we're trying to do to change the metabolism of the cell. And so it can actually go in the reverse direction. So for cancer patients, only in something like glioblastoma, where it's not as likely to spread to other areas, go plant-based would be going plant-based would be a nice choice. Also, we talked a lot about methylation. So methylation is not just the breakdown of B vitamins, but it translates to how our body makes antioxidants. This is why I am a huge proponent of genetic testing. If you have questions about methylation testing in your patients, that's something that I personally provide. So you can contact me about that personally if you have questions. But whether or not we're talking about hormone breakdown or the development of cancer, methylation defects can accumulate over time. So that's something that we want to test for and get very clear about our requirements for our patients. If they need methylated B vitamins, how they're making glutathione, and how they're converting to other B vitamins as well, so we can see how well their cells are detoxifying. Also, red light therapy. So red light therapy is something I actually have my red light panel hanging right here on my door. And I am a very big proponent of mixing that along with methylene blue. So oral methylene blue in oral capsules is something that we compound at Physicians Preference Pharmacy. And it's recommended for many different things, not just for cancer, to take the methylene blue 30 minutes prior to the red light therapy session so that you can really achieve something called photobiomodulation. That means that the red light and the benefits of red light therapy and methylene blue are getting further driven into the cell, and that makes it more effective. Now, from a compounding standpoint, there was a journal that was released in, I believe it was September of last year, which would be 2024. And I'm going to share this with you here. So actually, we are looking at a journal in a article in the Journal of Orthomolecular Medicine called Targeting the Mitochondrial Stem Cell Connection in Cancer Treatment. Now, this is scrolling down to page 7. And the reason I highlight this here is because it's important in the conversation around ivermectin and benzimidazoles. And so for us, what we're talking about is ivermectin and mebendazole. So we know that mebendazole and fenbendazole are different types of benzimidazoles, and I'll make a comment on that. So ivermectin, we've been using for many years. We know that there is a strong anti-parasitic relationship, candida, heavy metal, parasite relationship to cancer. And that's why we have to talk so much about how to gently detox but effectively detox our patients and how to rid them of candida. So we also compound nystatin. We utilize fluconazole and a yeast-free eating program to cleanse out our patients. We ask them to do this routinely once per year, partially for these reasons. Also, gently heavy metal detoxing. I'm a big fan of using citrus pectin, which in the form of pectisol found in some supplements is a more concentrated version that can help with hormone detoxification and heavy metal detoxification as well. But let's talk about compounds. So compounded ivermectin is something that at Physicians Preference Pharmacy, we offer in increments of 3 milligrams, starting at 3 milligrams up to whatever your patient needs. We're seeing here that up to in high grade cancers, that dosing at 1 milligram per kilogram per day can be very beneficial to helping to halt cancer growth, according to this article. Clinically, what I see is it's probably better to do that calculation and start your ivermectin naive patients at 0.5 milligrams per kilogram per day. Work them up over a couple weeks, so that total daily dose of 1 mg per kg per day. And then after you get them through month one, if they handle that okay, rewrite a new prescription for their 1 milligram per kilogram per day. I have seen patients go higher than this. So we are talking oftentimes around 100 milligrams or more. For mebendazole, very quickly, allow me to delineate here. Fenbendazole is an animal product. We don't compound for animals. That's commercially available for animals. We have a human drug as mebendazole, so let's use that. We also see clinically that fenbendazole usually raises liver enzymes more. Mebendazole actually hasn't elevated liver enzymes as much as we had anticipated. We have had great success in patients using 1,500 milligrams. I've even got one patient using 1,600 milligrams of mebendazole each day to help in reversing glioblastoma. And so it's part of that protocol. Again, a big player in cancer too can be parasites. And so that's part of the conversation that we're having here. That's why we utilize some of these antiparasitics. I have a lot of patients using ivermectin and mebendazole concurrently. So if you have questions about how to integrate this in for your patients, we can cycle them. Usually we do not need to because they're very well tolerated. And by the time people come to us, they're usually quite advanced and in many cases terminal. So they need everything that they can get. Additionally, methylene blue is a compound that we offer. I mentioned that we make that in oral capsules. So we make that in 5, 10, 15, 25, 35, and 50 milligram capsules. The patient does need a G6PD test done before that to be sure that they're not G6PD deficient. That is a blood test. And then usually I follow the same rules of dosing them at 0.5 milligrams per kilogram per day. So once you do that weight-based dosage, go ahead and round up to one of those available doses that we offer as a compound that I already mentioned. So I hope that this has been helpful. If you have questions on how any of these compounds integrate into any of your patient situations, please let me know. And again, we are here to help, we are here to serve and to partner with you ultimately to empower and to heal our patients.